Hi, I'm Dr. Rajani. I'm talking about chin injections today. The chin and what people call the pre-jowl. It's all about getting extension of that chin and getting that forward projection to change the angle or the nasion to chin angle that I've done several videos talking about beauty and a key beauty point. Now, chin fillers, a lot of people don't know they're available, that you can do it. They think you need a surgical implant, and sometimes that is the best, but a non-surgical injection option exists. That you're going to see a lot more about it coming up in the coming months and years. Of course, people have done it for many years now, and it's surprising because a chin implant is many cc's or many mLs or syringes, but it's interesting with filler. With just a few syringes, you can make a very nice difference. The average in the studies is anywhere from about 3 to 5. It's really important for at least 3 key reasons. So if you're sitting there and you're going, hey, my chin is fine, or I don't like my chin, or I don't know what it is. A lot of people don't know what it is, but it's one of a couple things. Number one, of course, loose skin, peau d'orange, because the muscle is hypercontracting because of loss of bone and simply age, loss of collagen on top of the skin. Also, facial shape. We know everyone wants a strong gonial angle. I have a lot of videos on that, but when it comes to the front, you want it to be narrow, because narrow gives you that V-shaped triangle of beauty, which is another important angle that we look at to evaluate beauty and youth. So the chin does many things. It's also connected to the nose. A lot of people think they need a nose job or their nose is big when in fact they need a chin. And we look at that nasion to chin line to tell us that, hey, bring the chin forward, and the nose is actually appropriate in shape. As you see from this picture here, when we change the chin in this video and bring it forward, the nose and the whole facial structure looks better because it's not convex. This is studied stuff. There's studied articles to prove it. Beauty is math. I'm going to show you the injections today of the chin. So without further ado, 3 seconds, we're going to do it. So remember to like the videos, subscribe, click the bell so that you'll be notified of upcoming videos, and definitely share them with your friends. It really helps us grow, and it helps them too because they get educated on procedures that they may be interested in. Now you see the measurements a lot occurring in the back along the jawline at the angle, but a lot of times people don't see the injector. When people get lip filler, they walk around the edge always and look at the 90 this way to see the nose chin projection, the AE line, Ricketts line. There's different ones, but if you look at that one, there should be about 4 millimeters from the top, 2 millimeters from the bottom if the chin is strong enough. Also, the nasion to chin angle is well important as well, but we do measure those and look at them deciding on the chin. And some people just style-wise want a chin that's farther projected, because what does it do? It gives the impression that the jawline is longer when the cervical-mental angle is weak, so it can extend the jawline in essence and tighten the skin. It does so many things. Filler does so many things. You want a high G' filler that doesn't bring a lot of water in. There can be bad things. There can be necrosis. There can be death of tissue, intravascular, and I believe from compression as well. So you have to be careful. When we watch the injections, you'll see we pull back on the syringe, make sure we're not in a vessel. So we're always looking along the whole jawline, not just the chin, to see if anything needs to be done posteriorly. Of course, we're going to look at the submental area, and we can dissolve fat at that time, remove it, or use radio frequency, high frequency ultrasound if we need to. We look at the nose and determine several things, and of course the nose can be injected to change some things as well. And we move the tissue just to see the mobility, and a lot of times you have to put toxin as well in the mentalis muscle to relax it, to help give it some length. Now we're looking at the AE line, and we look from the edge so that we see what the distances are, if they need to be changed or not, because you don't want to put chin filler if it would ruin those numbers and make the mouth look more set back in the face, because that can happen as well. Now we cleanse the area, of course, and then what we're doing is feeling the bone. Remember, if you go through muscle, then it bleeds, muscle bleeds. And we're going to use bolus technique underneath the muscle, and also knowing that the submental arteries here, some branches that come off the facial and the inferior labial artery, as well, we're looking for any signs of blanching, seeing if it's untowardly painful for the patient. That tells us as well. So we pull back and then we inject. Now, where do you inject? What are the landmarks? Just off center for a lot of patients. It's easy to keep it. You can tap to keep a little bit of pain control, and vibration of VAD works well. But if you see, you can put just off center or stay in the center, because having it too narrow or too pointy is not a problem. We can always reduce it. But if we create too flat of a chin, then we've wasted our filler. So we'd much rather just stay off center. The nares, straight down from the nares in a male, can give 2 points because the male can be more square. And again, this side we're doing 0.5, we did 0.5 on the other side, and you can see just sitting here, you don't need a before and after. You can see the projection take place. You can also see the lip and the angle of the lip, and if that needed to be addressed, we would. So you can easily get into 5 to 8 vials of filler if you address the edge of the mouth, the lip, and the jawline. It just takes some volume. So here you can see mine being done. My nurse will do it. I'm going to have mine injected just centrally, and just 1 ml of product, and you can see, so not everyone's 4 to 5, but I've had some already, so it's all additive. Here it's in the center. She pulls back, make sure she's not in a vessel, and then she's injecting the product. And a 1 cc bolus can be done. You just have to be very mindful. Sometimes halfway through, I'll pull back again just to double check I didn't shift, didn't change. You don't want to put 1 ml of a filler in any vessel. Bad news. And remember, the submental vessels are right there, and especially if you're coming off the midline, but going through the muscle will create bleeding a lot of times, and then you won't be sure, is it active bleeding, is it venous, is it old blood that you just created from going through the muscle. So chin projection gives you an idea. I'll also put some videos up. You can watch my old ones about treating the RBF with the same RESTYLANE Define. Doesn't draw water in. It has expression. It moves with you. It looks very natural. Because it's robust and strong, you get a lot of pop and power in one syringe, but it doesn't get that boggy look. And a soft, elegant filler, that's going to flow. You're going to lose that nice, crisp result. Have you had your chin done? Do you get your jawline injected? Does that help you? Let me know. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.